Cate is going to share her slides with us. And we will send this out in our recap that John sends out later in the day. So she will include those slides and her contact information. And today in her presentation, if you have questions, we're going to hold the Q&A to the end. So you can put your questions in the chat and Amber will monitor those and we'll start the Q&A at the end. Or we'll open it up at the end depending on timing. But we are going to let her get all of her knowledge shared with us. So my brief overview, I just met Cate this morning. So Cate Collings, she is board certified in cardiology and lifestyle medicine, and the immediate past president of the American College of Lifestyle Medicine. She was instrumental in moving the field of lifestyle medicine from the margins into mainstream medicine, including entrance into the American Medical Association. So that sounds like quite a feat. She currently brings her decades of clinical experience together with her coaching, exercise psychology, and culinary expertise to help leaders flourish in their professional, family, and retirement lives. I can't tell you how excited I am to hear all of this, Cate. So without further ado, we hand it over to you and look forward to your presentation.
Thank you, Cindy, for that nice introduction, and a shout out to Mary Rotuno, who introduced me to this group and made this possible. So I've enjoyed many of the Friday coffee hours in person and others by watching the recordings. And I love the spirit of this community and the openness. And so I'm looking forward to sharing the field of lifestyle medicine and why it's important for you, your friends and family, our nation, and really the world at large. So I'm going to go ahead and jump right in. I'm going to share screen. All right, everybody see that okay? Okay, great. So the objectives today, from the big picture view, are to define lifestyle medicine so that you all can understand what this most rapidly emerging medical specialty is all about and its value. I'm going to touch not a lot on the background science, specifically focusing on this concept of epigenetics and how it surpasses genetics in health outcomes. And then spend a little bit of time at the end up and personal, why knowledge is oftentimes not all the power we need. So the field of lifestyle medicine, I'm going to get something out on my screen here that would help me. Wouldn't mind. Is a medical specialty that uses therapeutic lifestyle interventions to treat conditions, chronic conditions, included but not limited to cardiovascular disease, type 2 diabetes, and obesity. And lifestyle medicine clinicians of all sorts use the 6 pillars of lifestyle medicine as a framework, focusing on whole food, plant-based nutrition, regular physical exercise, which I say is targeted to conditions and personalized, but also focusing on whole person care, if you will, through also integrating restorative sleep, the avoidance of risky substances, positive social connections, which remarkably have great health outcomes, as well as stress management. Let's make sure I got this to, I'm going to use this little arrow down here. There we go. So why is lifestyle medicine so important and now? And probably if we look at the single most important reason, it's because we have a chronic disease epidemic in the United States. Probably not new to all of you, but 6 in 10 Americans have chronic disease, and 4 in 10 have 2 or more of those conditions. About 38% of Americans will be diagnosed with cancer at some point during their life, and half will have cardiovascular disease. And this is not slowing down. We have 34 million in the United States with type 2 diabetes, and another 88 million with prediabetes, and only about 10% of those individuals know that they're pre-diabetic. And so much talk about overweight and obesity these days, but yes, about 3/4 of Americans are either overweight or obese. It's important because this is a big burden in terms of the economics. And I know you read this, as do I. Sometimes it's focused on Medicare. Can we support Medicare for, in the future? But healthcare costs in the US are costing about 3.3 trillion. I think that's about 20% or more of GNP. And 80%, this is the important thing, of these costs are attributed to these chronic, largely lifestyle-borne conditions. So if we look at just the economics of diabetes alone, people with diabetes have 2 to 3 times the cost of care of people who don't have diabetes, and that's attributing it to about 245 billion in the US now, and estimated in just 6 years, remember 2030 is only 6 years from now, as being 7.2 trillion. So this is a huge burden, and we can push it off and say, well, that's the problem of employers, or that's the problem of insurance payers. But ultimately, it always comes back to us, because we're paying for all of that in one form or another, either in terms of our premiums, in terms of our wages, which are not going up because more of our wages are being paid for health care of us and our fellow employees. And then, of course, the just general tax dollar. Lifestyle medicine is also important because there is a decline in US life expectancy. And this is a report coming from 2019, I guess, looking at life expectancy and mortality. And we oftentimes say, yay, yay, rah, rah, we're so strong in healthcare in the United States. But guess what? Compared to other high-income nations, we have a downward trend in our life expectancy, meanwhile having a higher per capita healthcare spend. Some of it has been attributed to drug overdoses and mental illness, but it's disputable, because a lot of the data really drives back to cardiovascular disease, and that we really haven't increased the life expectancy. So lifestyle medicine is also a response to consumer demand. And I know I certainly saw this during my clinical years. My patients were often left on their own to search for lifestyle sources of information in the marketplace. And they landed on non-evidence-based sources of information or programs. And they often spent a big dollar on those because they weren't getting the answers in their doctor's offices. So they were left to go out and really kind of be victims of a marketplace that would love to take their dollar and tell them whatever they want to hear. So Gallup data suggests or supports that 3/4 of patients wish their providers gave them more guidance in lifestyle and self-care, and yet only 40% of those providers felt confident to do that. And I think I'll show you later how that's changing, but we still have a long ways to go. Lifestyle medicine became particularly important in the pandemic. And I know you read the same headlines that I did, but maybe you didn't read all of them, because I was reading them from the healthcare perspective. But I really saw COVID as a pandemic within a pandemic, because if you remember, the comorbidities of people that died as a result of COVID or were hospitalized were often the individuals who also had the comorbid conditions of diabetes or obesity or hypertension. So this was really a collision, a foundational issue with the overall foundational health of our country, and then with the superimposed COVID on that. And a lot had been written about that. COVID also shone a light on health disparities and health inequities. Similarly, just because, again, the spotlight went on these marginalized communities who were showing increased death rates, and we also, and you tease that out, often had a lot of comorbid conditions. Every few years, a report comes out called the U.S. Burden of Disease Collaborators, and there's also one that comes out, the Global Burden of Disease Collaborators, and they go into databases and derive what are the leading risks. And this is the most recent, looking at deaths and percentage of disability-adjusted life years. And if you look at the top 10, you'll see many lifestyle factors within that, but number one is dietary risk. So dietary risk is considered the number one risk for death and disability in the US as well as globally. And yet, with that information, only about 3% of Americans are living a healthy lifestyle, according to this Mayo Clinic study of about 5,000 participants. This was data derived from the National Health and Nutrition Examination Survey and looked at what percentage of Americans met these 4 criteria, which is exercising at least 150 minutes a week, a diet score at the top 40%, which isn't a very high bar, a body fat percentage under 20 for men and 30% for women, and who were not smokers. So we have a ways to go on that as well. Why is this? And I think this goes back, this is a quote from Wendell Berry, who's an agriculturist and a poet. To say that people are fed by a food industry which pays no attention to health, despite what the top, the front of the package says, and are treated by the health industry, which pays no attention or historically has not paid attention to food. And I think, again, I'm going to show you that that's changed a little bit, but we have still a ways to go. So lifestyle medicine takes a different approach. And I would say what I want to convey in this is it's a more prescriptive or interventional approach than counseling. Now, you'll see lifestyle counseling in all of our clinical guidelines, whether it's hypertension, whether it's high cholesterol, whether it's cardiovascular disease. But it's a counseling, and I call it kind of a drive-by. As you're shaking somebody's hand and they're walking out of the door, you say, try to exercise more and eat better. But that's the counseling. That's what's happened. But lifestyle medicine takes a more prescriptive approach using the prescription of foods. Even now, food prescriptions as we think of it, that go out and buy foods with them. That's a big area that's been developed. Disease-focused exercises, medicine prescriptions, and then a prescriptive approach to things like social engagement, sleep, of course, stress management, and also substance use. So lifestyle medicine also takes some new approaches to healthcare. So the advantage of in a lifestyle medicine practitioners or physician or clinician of any sort, perspective is really try to reverse the disease trajectory and restore health. And that's very different than the approach, the typical allopathic approach, which is I can take care of this, I'll give increasing amounts of pharmaceuticals, use procedures when I need to, and we're just going to go along. There's nothing, I'm going to not say there's nothing necessarily wrong with that, but the perspective is not like I'm going to try to actually tap this down and reverse trajectory. Lifestyle medicine also leverages the psychology of behavior change and setting people up in terms of behavioral economics to help them with their lifestyle patterns. It also uses some interesting clinical models such as shared medical appointments and digital tools. And in the larger picture, when we think of population health, it attains the desired, what we call the quintuple aim in healthcare, is we need to get better health outcomes. We need to get better patient satisfaction. We need to lower the healthcare costs, lower the important area of clinician burnout, and improve health equity. I want to show you just one of the, I've got 2 case studies here, but I'm just going to have you pay attention to the one that at least is on the right hand of my screen, the 61-year-old woman. And I kind of want to give you the flavor of how a case in lifestyle treated by a lifestyle medicine physician might go. So this is a woman who has diabetes, not obese, a normal body mass index. And she, however, is on 4 diabetes medicines, including insulin, and still has a hemoglobin A1C, which is a diabetes marker that's markedly elevated above the 6 guideline. She was transitioned from a usual diet to a low-fat, plant-based diet, and in 4 years, and you can say, well, 4 years, that doesn't happen overnight, but she came off all of her medications and off of all medications without much of a change in her weight, because she didn't really need to lose any weight. Her hemoglobin A1C, again, that marker of diabetic control, is within normal limits. So here's an example of the goal in this situation. This individual was also motivated was to actually reverse diabetes. So I hope I've shown you in this that lifestyle medicine is very distinct from preventive medicine, from many of the fields of alternative medicine, and from wellness services, because it is a clinical discipline. It exists within clinical treatment guidelines. The word lifestyle has been in those guidelines for years, but has been sadly bypassed because of a lack of physician training, system integration, utilization of some of these novel things, and the awareness of its effectiveness. I don't think most physicians said you just can't do that. When somebody has diabetes, for example, you just got to manage it. And I'm not saying there was anything wrong with that, but that was the understanding and that was the training. So the field, I want to tell you just a little bit about the American College of Lifestyle Medicine and how it has been instrumental in growing this field. And this is a 20-year anniversary for the organization. It was founded by Dr. John Kelly, who was a preventive medicine physician out of Loma Linda in 2004. And in 2010, the core competencies of lifestyle medicine were published in the Journal of the American Medical Association. And then it was in 2017 that we established board certification. Now, the board certification is both for physicians, but there are also certifications for nutritionists, health coaches, nurses, NPs, PAs, and so forth, even pharmacists. I was part of that inaugural class that took that exam. In 2022, we had the honor of being invited to the White House Conference on Hunger, Nutrition, and Health. We considered that a real milestone because we had then grown to recognition at that level. And that was exciting. I represented the ACLM at that conference. And then in 2024, just this past June, we were inducted into the House of Delegates with the American Medical Association, and I'm their delegate for that. And this puts us in a position to be able to advance resolutions for patient care from the perspective of lifestyle medicine. We were also recognized as a medical specialty in the American Association of Medical Colleges. Also, just recently, I think this was June or July of this year, the World Health Organization showed lifestyle medicine in alignment with their framework. But specifically in here, conventional medicine, what most of us have, been patients of or practicing, is considered in the overarching area of biomedicine. It's in accordance with what we know about modern science. It's generally well documented and it has a high acceptance. And lifestyle medicine is in accordance with modern science. And I'll tell you a little bit more about some of those sciences in a second. The effectiveness is now the evidence is now increasing, and the acceptance is also increasing. I think you could see that from the prior slide. And then just a quick look at this very busy slide, but just to say, lifestyle medicine isn't just something off on the side. It's really needs and is being integrated into primary care areas, into specialty care, and it's founded in multiple different levels of types of sciences, and is all hung together, if you will, knitted together through a recognition of social determinants of health and meeting people where they're at. This is shows the growth of the field. I joined the organization in 2016 when we were 500 members, and we are nearly 12,000 now. So really an exponential growth. It is considered to be the most rapidly growing specialty. Most physicians are board certified in another field and then take a dual certification in lifestyle medicine. In the organization, we have 30 member interest groups. They go across all different areas. It could be employee health, it could be nurses, it could be pharmacists, it could be cardiologists, any number of things. We have 30 sister organizations globally. We have 110 health systems working with us, 350 residency programs now. So this is so important because we knew we had to train this new workforce coming in. And more than 150 lifestyle medicine interest groups, and those are in medical schools. So again, bringing the future physicians forward on this concept, so that this is just the way they practice medicine. We have many partners now at the national level, Population Health Alliance. We have payers, Blue Shield, Blue Cross, Humana, the Institute for Advancing Health Value. This just shows a few of our partners at national levels. And this shows a few of our health systems, and this isn't the whole list, but some of the institutions that are, actively working to build initiatives in lifestyle medicine, bring lifestyle medicine board certified physicians and clinicians into their solutions. And so we're really excited about this. So this cute puppy is here for the reason that I went to kind of explain why did I go into lifestyle medicine. So during my cardiology career, when I mentioned my pivot into lifestyle medicine to colleagues, to friends, to patients, I was often met with a look like this. And this is a cute look on a puppy, but it was a bit disarming coming from people. So, the question like, when I was in this exciting field of cardiology, just full of life-saving techniques in my hands, why would I pivot and focus on lifestyle medicine? So maybe my short answer was that while I might save a life, I was not treating the root cause of my patient's problems, and I was just going to go through the drama of saving that life again. So my undergrad and graduate studies were in exercise physiology, and so very early on, I saw the power of exercise as a medical intervention. Back in those days, I was jogging around the lakes at the University of Wisconsin with cardiac patients, most who had not benefited from things like angioplasties or bypass. So kind of high risk, they had heart failure. And I became quite amazed at what we could do with them in terms of their survival. And so that actually led to me, going to medical school. And during my, what I learned in going to medical school and through my residency is none of that information about exercise was part and parcel to my training. It was just completely left off to the side. And then during my years of clinical work, there were just amazing pharmaceutical and procedural advancements at the time, and we just had so much that we could do. So we had this parallel increase in all these advancements, and yet there was this parallel increase in chronic lifestyle-borne conditions. So there was really a blind spot, and we just weren't using all the science. So also, and I alluded to that before, my patients were trying to source information. They weren't getting enough from me, and they were trying to source information about how to take better care of themselves. But they were getting a lot of mixed messaging in the media. So I knew I needed to go back for more lifestyle education. I also needed a better practice model to practice that better. And I needed to learn this important area of the science of behavior change. I think we have some coaches and others in this community. And as Cindy said, I went into some culinary medicine because I found I needed to teach my patients how to cook as well. So I've had many exciting opportunities and, really been able to reclaim a lot of the joy of helping people. So I wanted to give that as a way of kind of understanding why I would go into this field when I already had a nice field of medicine. So now I'd like to just jump into a little bit of the science of lifestyle medicine. And this is a really busy slide. You will not be tested on it, but just to kind of show you a little bit of an overview of where the science is at the very basic level. And this was a summit held in 2020 and a publication that came out of it. Sorry.
Sorry, we muted.
Okay, we're okay? Okay, all right.
Yes.
So, just this was a group of various researchers, US and international, looking at where the research needs to go to further understand how lifestyle works in leading to these chronic diseases. Good lifestyle, healthy lifestyle, or unhealthy lifestyle. And if you really look at the three areas, it has to do with the microbiome. Probably many of you have read about the importance of the microbiome, the gut microbiome, the oral microbiome, just a lot of information. So there's a lot of science in that area. Cellular stress, just direct cellular stress from various habits. And then this other area, epigenetic changes, which is actually instrumenting on DNA, which is a fixed thing, but the expression of DNA through epigenetic changes that help happen related to healthy or unhealthy lifestyles. And that all kind of comes to a common pathway of inflammation. And inflammation is then another kind of underbelly to all of these conditions that kind of may seem a little different to you, like cancer is different than heart, but as it turns out, the same sort of pathophysiology leads to all of these conditions. So this was a article that Time had, and it's actually quite dated, but to say your DNA isn't your destiny, and really pointing the finger on epigenetics. And so I want to talk just a little bit about that. I'm not an epigeneticist, but I'll give you a little bit of a view of this. So epigenetics likely will be your destiny. So epigenetics is really the study of everyday lifestyle habits that turn on and turn off gene expression. So we don't have control over the genes, but we do have the ability to rapidly turn on and turn off their expression. So it's really everywhere. It's what you eat, who and how you interact with others, how you sleep, how you exercise. So, I really summarize it that lifestyle expression equals epigenetics. And there's a lot of fancy ways that this happens. It's through things that I know not too much about, but DNA methylation at the DNA level, histone methylation, and so forth, and much, much more to that. But this is kind of a simplification of showing that we have our environment, we have our habits, and it is through this modification of DNA or gene expression that we land with various chronic conditions. One of the exciting areas for me was to explore exercise epigenetics and to realize that the changes in the DNA methylation and expression of mRNA, and I know people probably know about mRNA from our COVID vaccines, could be rapidly changed. And that there were actually different pathways for these epigenetic changes based on whether you were doing endurance exercise or resistance training, which is probably why we can see different effects of those in terms of health outcomes, whether we are emphasizing resistance training or endurance, but it's also why both are recommended. And then, of course, there is rapid epigenetic change with nutritional modification. And this was a very recent study done out of Stanford and a few other institutions, where they had 22 identical twin pairs. So here we have genetics pretty nicely controlled for, and they randomly assigned the different twins to two different healthy diets. One was a healthy plant-based diet, and one was a healthy omnivorous diet. And they provided the food. They provided, sessions with the nutritionist, counseling, regular follow-up. So it was very, a lot of hands-on, so they could get a good control of this. And they were able to show that the healthy plant-based diet had a more protective cardiometabolic advantage compared with a healthy omnivorous diet. Now, my point on this is not to say one diet, I'm promoting one diet or the other. What I want to demonstrate in this is that this was, I believe, an 8-week study, 8-week or 12-week study, is that you can make these rapid epigenetic changes, these rapid changes, which have to come through epigenetic pathways, with the genetics held constant. And so, over days, months, or years, you can see the same individual things can look quite different. The vantage can look quite different based on those everyday habits. And if you want to learn more about this was a real eye-opener, aha moment for me, and maybe for you or maybe not for you, but these are 3 other things that I think are really ways that you could go and explore this. One is a TED Talk that you can find on YouTube by Kent Thornburg, who's out of Oregon State. Another by a book by Judith Finlayson, and then another book by Ken Pelletier, a little bit more recent, I believe. He's at UC San Francisco. All right, and this is the third part. I'm going to just check my time here. I think we're pretty good of my talk, and I'm hoping to have some time at the end. But why knowledge is not all the power you need. So I'm not someone who reads comics very often, but I thought this was a very poignant comic. So we've all probably found ourselves in this situation where one person, maybe a spouse, is saying, I've been thinking about you lately. And he says, I wish you wouldn't do that. She says, I have something for you. I made a list of ways that I think you could improve yourself. Now, don't get defensive. I'm just trying to help you be happy. So he takes the list, walks away, flushes it down the toilet, and says, how about that? It did make me happy. So, if we think about it, one of the strongest human instincts is to impart information. And for people who have drawn to healthcare, we're the worst of it, right? Because we want to impart it. We want people to do it. We want to just say it and make it happen. But the second strongest instinct is to resist it, right? We want to live our own life and do it the way we want to do it. And I'm no exception to that. Ed Deasy, who is a large person in the a notary a important person in the area of behavior change says we should not ask how to motivate others, instead ask how can we create the conditions within which others will motivate themselves to be healthy. And I think we do have a number of people in this area who have either are coaches themselves or have received coaching and can appreciate that. So another way of saying it is, even when a client knows what they want, they read about what to do, or even if they pay to learn what to do, this knowledge alone may not result in any change in their behavior. And they may even act against their own best interests. So we have an area that I'm particularly interested in, which is in executive health. And the leadership in executive leadership, and I know many here are involved in that, is a very important and very valuable thing. More than 60 billion is spent globally on executive leadership programs. And yet 19 CEOs died in office in 2023. So that was more than in any year since 2010. So we know that executives experience inordinate stress. They oftentimes need to be working across multiple time zones. They value privacy and may not be accessing healthcare in the usual way, or be able to for a variety of reasons. And we know that executive personal health really has an impact on organizational performance, particularly if they're out for months and somebody in the C-suite is out for personal health reasons. So I think the return on investment of prioritizing executive health is improvement in modeling towards employee health, can translate therefore to reduced healthcare costs in the employees and improved organizational engagement. I think it's not been, the executive health has largely been in doing extensive screening tests, but it's not been in doing a lot of health coaching for executives. So the International Coaching Federation defines coaching as partnering with clients in a thought-provoking and a creative process that inspires them to maximize their personal and professional potential. So coaching is not a natural within, is not how physicians and other clinicians have naturally been trained. We've been trained to provide solutions and answers. We know that no matter how sound the underpinning science is, and I've shared some of that with you, or how practical and clear the steps are, telling our clients, our patients, what to do, how to do it, and when to do it, sometimes still does not result in any concrete action. And so it's really coaching skills that can offer a different lens to help people get closer to their desired results and their own desires. So some of you, again, may be familiar with this, but to utilize this, we really have to understand a lot, which is in the coaching science and research, things like the trans-theoretical model of change, understand readiness to change. Don't try to help someone before they're at a stage that they can receive that intervention. Clearly understand the differences between wearing an expert hat or a coach hat. Leverage positive strength-based conversations over, what's wrong with you, obstacle-based solutions. And then again, using some of the novel techniques, which is peer-to-peer engagement, people help heal in community, and setting up sustainability models. So this concludes my my presentation, and I can go on to some questions, but might ask everybody to just take a minute or two, if you want to, turn off your video, But think about 1 year from now. Imagine if you had accomplished your desired health goals. What would your life look like then? What would be the activities that you would be doing? How would your day start? How would your day flow? And how do you feel? How do you feel at multiple levels, physically, just in your general overall well-being? How do you feel emotionally? How do you feel spiritually? And think about what steps did you take to get there? Happy to take any questions. I'll let somebody else moderate who.
We will.
Okay,
Cate, thank you so much for all of this information. Yeah, I was rapidly taking notes and thinking you're very thought-provoking, and certainly this is a wonderful approach to how we should look at our lives and what we're doing with our health issues. I know we had several questions in the chat. Amber, do you want to go back or did
Yeah,
you?
so I think the first question that came to us was about the difference between lifestyle medicine and functional medicine, but I think you covered that already. So we'll move on to the next one. How would a patient go about finding a primary care physician who's board certified in lifestyle medicine? Is there a list online?
There is a list at lifestylemedicine.org, which is the American College of Lifestyle Medicine.
Wonderful. Udo has a question. I think he's also got his hand raised, so I'll let him take this.
Okay, I'll just be real brief. I have an 18-year-old daughter of a friend who is about to go into a 2-year associate's program that's related to pharmacy. Long story short, from what I understand, she's really trying to go more down the path that you're in today. And so my interest is how to connect her with the right schooling to make that as easy as possible. Because at the path she's going now, she'll eventually have an MD. Then she's thinking about spending another 2 or 3 years studying more holistic medicine. I'm just wondering a shortcut approach, preferably with actual intern experience that can help settle whether this is something she wants to do.
Yeah.
In the Raleigh-Durham area. I'm not asking for much.
Yeah. Let me just ask a question. So she's 18?
Yes, she
So
just got out of high school.
She just got out of high school, right? So, and is she already destined for a certain college?
There's a local 2-year program that transfers credit to a 4-year program, so
Yeah.
you know, such as in Wake or UNC.
Oh, she's in North Carolina?
Yes.
Yeah. Well, there's a phenomenal medical school in South Carolina where she could maybe end up heading towards in Greenville. I believe that's right, not being from South Carolina. The University of Greenville. They have lifestyle medicine built into their all 4 years of medical school. She might even be able to reach out to, you can reach out to me independently. I may be able to put her in contact with the lead person there, just because she could then maybe direct her to an undergrad that could effectively help her lead her towards that. And if she's on that side of the country. The other big area that has done a lot in this, of course, is Loma Linda. But as I shared, we're seeing it in a lot of residency programs across the United States. But you can reach out to me independently and I can maybe get you in contact with the South Carolina professor.
Sounds great. I appreciate it. Thank you.
Yeah.
Oh, Judy had a couple questions and she's got her hand raised too, so I'll let her take it.
And I think I had a few, I think you just addressed a few of them, like what would be good medical schools to suggest to someone who wanted this as their specialty, and where are they offering residencies that would go with this
Right. Yeah.
specialty?
Well, the residencies would all be probably found also on that same website, lifestylemedicine.org.
Okay.
Possibly on the American Board of Lifestyle Medicine, would have a list of all those residencies, because again, there are 350, so it is across the country. Yeah,
Okay, and how is this differing? I think the other man hit on this a little bit. How does this differ from homeopathic and integrative medicine?
right, right. So I am not an expert on homeopathic, but I can give you a little bit of sense of integrative medicine, and somebody else brought up functional medicine. So, you know, integrative medicine, it depends on the terminology, or different people will use that different ways, but typically integrative is a blend of East and West medicine, more the Eastern modalities are more forward in that. So the utilization of, say, Reiki or yoga or acupuncture or acupressure, that might be a little bit more of the focus, blending that with, if you will, Western medicine. But again, I don't want to speak for someone else's definition, because a lot of people call themselves an integrative physician because they take a generally holistic approach. And I could say I'm integrative in that regard as well. Now, functional medicine relies a little bit more on novel lab tests that are not yet fully baked for common use. So they'll do a lot of extensive testing, usually not covered by insurance and so forth. And their focus is a little bit more targeting that laboratory data. And again, I don't want to speak for all functional medicine doctors, and I would say that some lifestyle medicine doctors might use some of those labs as well, right? But in terms of just a general focus, a lifestyle medicine physician is going to take a big focus on nutrition and exercise and the 6 pillars. They might use that laboratory as an augmenting, but that will be a secondary approach.
Okay, and how would we find that healthy eating index that you spoke about? Could we just Google that to find it?
Yes, you should be able to find it. Yeah, the HEI. Yeah.
Okay, thank you.
Alan has a really good question. I think this is, what are 3 quick and easy steps that I can start with on Saturday to start a more healthy lifestyle plan?
Okay. The 3 things. I would say, make sure you are eating fiber-rich diversity of plants, lots of colors, the rainbow. That would be number 1. Number 2 would be walking, starting an exercise. If you aren't an exerciser, anything is better than none. Don't try to be perfect on it. If you are already exercising, look at where, if you have not, if you don't have a whole balanced program. And number 3 would probably be sleep. It's hard. You limited me to 3 instead of 6, but it would be really prioritizing sleep, at the quality and the quantity as well.
Wonderful. Paul, I'll let you go next.
Yeah, thank you. I actually put a lot of questions and comments into the chat. I know there are a lot of, sort of biohacking specialists out there, including Gary Brecka and Dave Asprey, and they recommend quite different approaches. And I'm just curious what you think about the 2 of those, to the extent you know them. And also, are you familiar with the Life Force program, which is part of Tony Robbins' overall program?
Right, and I will plead ignorance on the first two. Except in a general, if you, in a general term, anytime I hear the word biohacking, I'm not, I'm not drawn to that. I don't think, I think they were premature on a lot of hacking, aging, hacking, anything. I think, it's aspirational, but I think it's a far cry to think that we can do that. But I don't know the specifics of it, so I'll plead ignorance on that. I know the name Tony Robbins. Is it Tony Robbins that you mentioned?
Yes.
Yeah, but I don't know the details of his program to be able to comment on it.
Okay, well, they measure 40 different biomarkers. Through blood work. And I just got back one that was very concerning to me, with a C-reactive protein cardiac score of 8.63. And my previous result from a few months ago was 0.44. And so any high for a cardiovascular event is anything over 3. So 8.63 is rather of concern to me. I'm wondering if it's not a lab anomaly there.
Well, I have a healthy respect for a lot of these biomarkers, and are they really prime time? And is the normative data really set? I mean, I think it's very intriguing. This is a lot of what you find in functional medicine. The question is, do we have the data long-term that says what is the predictive outcome? Because when you look at those, basically that's just another level of screening test. It's not applying any, intervention to it. It's saying, here's a biomarker that points in that situation to cardiovascular disease. Well, we have a standard CRP available to us that we've been using for years that, when elevated, does suggest some action plans behind that, whether it's in conventional medicine or lifestyle medicine. So all these novel markers, they're really great from a research standpoint. Totally support that we can maybe learn more and more. I think probably what will distill down to, 1 or 2 becoming clinically useful, down the road.
Thank you, Cate. We are at the top of the hour. I know there are more questions, but unfortunately, we do need to conclude and be respectful of everybody moving on in their day. So I would encourage those that did not get their questions answered to reach out directly to Cate. Her information is on the screen, and of course, we will send that out to you. Cate, I can't thank you enough. From all of us at PRG and our community, so appreciate all of this information. I can tell by the chat and everybody's faces that we've all come away with takeaways and ways to improve our life in so many different directions. Thank you, thank you. To all of you, we wish you a great weekend. Stay cool, and we look forward to seeing you at another coffee in a couple of weeks. Thank you all. Take care.
Thank you.
Thank you.
Thank you.
Have a good weekend.
Thanks, everyone. Thanks all.
Kate, thank you. That was excellent.
Like top
Thank
of the
you.
hour, top of the morning.
Fantastic.
The Irish saying.
Bye-bye.
Have a good one. Have a good